Hi, hello friends. How are you friends? Welcome to my channel, The Voice of Nuts. Please friends, one click and one like. Today my topic is NHM Staff Nurse 2023 January means this month only. Questions with answers, detailed explanation. This is part 2. Actually in previous videos I already explained this one part 1. Before moving on topic, like a video and please give a comment and subscribe my channel and share the video and click on to bell icon. Okay friends, move on to topic. The continuation of question, 31st question. Previous video 30 questions is the 31st question. Oliguria is a condition where urine output is less than. Options: option A 400 ml per day, option B 600 ml per day, option C 100 ml per day, option D 800 ml per day. Answer is option A 400 ml per day. Oliguria means the decreased urine output is called as oliguria. We can see oliguria condition in most commonly kidney patients, means dialysis patients or those who are suffering with kidney diseases. We can see oliguria condition. Here option A 400 ml per day is the answer. Next move on to 32 question. Question number 32. Chorea is the major central nervous system manifestation of. Chorea means one of the manifestation, one of the clinical manifestation of central nervous system. The options are A. Acute rheumatic fever, B. Valvular heart disease, option C. Cardiomyopathy, option D is eye problems. Option A is the acute rheumatic fever is the correct answer. Why central nervous system is involving means chorea is an abnormal involuntary movement disorder, means involuntary movements means nervous system involved. So this chorea is a manifestation of rheumatic heart fever. Okay friends, option A acute rheumatic fever is the correct answer. Next move on to 33 question. Question number 33. In myocardial infraction commonly used medicine is option A streptomycin, option B streptokinase, option C bronchodilators, option D digoxin. Answer is B streptokinase. What is myocardial infraction? Myocardial infraction is a blockage of blood flow to the heart muscles, means the blood circulation will be blockage will be done in myocardial infraction in condition the most of the medicines, means streptokinase is the treatment for myocardial infraction. Okay friends, option B is correct answer, streptokinase. Next question, 34th question. Acute complication of diabetes mellitus is option A retinopathy, option B hypoglycemia, option C hypertension, option D nephropathy. Here diabetes mellitus, in question diabetes mellitus means the complication will occur sugar levels, means related to sugar. Diabetes means related to sugar. Here related to sugar option is hypoglycemia. Okay friends, option is B hypoglycemia is correct answer. Hypoglycemia means low blood sugar levels, means below the 70 mg for dl is hypoglycemia. Hypoglycemia means less than the blood sugar levels below 70 mg for dl is correct answer. This is the complication of diabetes mellitus. Option B is the correct answer. Question number 35. Tracheostomy is performed usually. Option A between third and fourth tracheal ring. Option B over fifth tracheal ring. Option C between the first and second tracheal ring. Option D over the third tracheal ring. Option A is the correct answer, between third and fourth tracheal ring. The trachea opening means tracheostomy means opening the trachea and giving breathing. The tracheostomy is one of the life-saving procedure for providing the mechanical ventilation to the victim or any patients. Next, The tracheostomy is a tube can be inserted to the trachea for breathing purpose. Here option A, between third and fourth tracheal ring, option A is the correct answer. Next question number 36. The 36th question, positive Kernig sign seen in. This is the one of the sign we can see in which patients? Option A, encephalitis. Option B, meningitis. Option C, pharyngitis. Option D, myelitis. Actually, Kernig sign means inability to extend the legs, means involved central nervous system. Here option B is the correct answer, meningitis. The meningitis means inflammation of the brain and spinal cord membranes. Due to the inflammation of the brain and spinal cord membranes, the patient will not able to extend the legs. Means option B, meningitis is the condition. We can see the positive sign, Kernig sign is there in means meningitis is having. So option B, meningitis is the correct answer. Next, move on to 37th question. 37th question is commonest cause of stomach ulcer is. The commonest cause here mentioned option A, H. pylori infection, option B, starvation, option C, insomnia, and option D, intake of junk foods. Means stomach ulcers cause, here insomnia means loss of sleeping. Intake of junk foods means that is okay, but main cause here the infection will occur for ulcer, means something infection will occur, means H. pylori infection. Option A, here option A, H. pylori infection is the correct answer. H. pylori is a bacterial infection. H. pylori bacteria is a that cause infection in the stomach. So the commonest cause of ulcer is H. pylori. 38th question. The 38th question is tunnel vision occurs in. The tunnel vision occurs in option A, untreated glaucoma, option B, myopia, option C, conjunctivitis, option D, all of the above. Means the problem will happen in vision. Means here myopia means the near sightness. Conjunctivitis means infection of the conjunctiva. Means tunnel vision means the loss of peripheral vision. Actually tunnel vision means loss of peripheral vision with retention of central vision. Means here answer is option A, untreated glaucoma. In untreated glaucoma we can see the loss of peripheral vision. This is option A is the correct answer, untreated glaucoma. Move on to 39th question. Pap smear is common diagnostic approach in. Option A, cancer of ovary. Option B, cancer of cervix. Option C, cancer of fallopian tube. Option D, cancer of breast. Actually, Pap smear is one of the diagnostic evaluation, means diagnostic test. In Pap smear test, the collecting of cells from the cervix. Collecting of cells from the cervix. Why? It is test to detect the abnormal cells in the cervix. Actually in women's cancer of the cervix is the most common cancer, one of the type of most common cancer. It give more greater chances to cure. Option B is the correct answer, cancer of cervix. Question number 40. Physiological jaundice occurs in option A, after 24 hours of birth and serum bilirubin will be less than 15 mg per dl. Option B, before 24 hours of birth and serum bilirubin will be more than 15 mg per dl. Option C, after 24 hours of birth, serum bilirubin will be more than 25 mg per dl. Here option D is both A and C is the correct answer. Means here option A is the correct answer because usually serum bilirubin levels, means physiological jaundice will diagnosed, means identified within the 24 hours of birth usually occurs on the second and third day of newborns. Physiological jaundice will occur in second and third day of newborn babies. It main cause excessive bilirubin levels in the blood. This is the most common cause for physiological jaundice, and baby is having less than 15 mg for dl is the correct answer. Baby is having bilirubin levels less than 15 mg for dl is the correct answer, option A. Next move on to question number 41. The 41 question is sunset eyes is a hallmark of option A meningitis, option B hydrocephalus, option C spina bifida, option D mellitus. Here option B is the correct answer, hydrocephalus. The sunset eyes is associated with severe disorders signifying intracranial hypertension will be happen. In this case, cerebral spinal fluid will be increased in this cases most common. Here we can see the baby picture of the baby head, hydrocephalus means hydrocephalus head. Extra fluid puts in the pressure on the brain can be cause of brain damage. Option B hydrocephalus is correct answer. The 42 question number 42, hormone responsible for secretion of milk is option A oxytocin, option B prolactin, option C estrogen, and option D is progesterone. Actually all of you know option B is the correct answer, prolactin. Oxytocin will also produce the milk, but prolactin is a necessary for secretion of milk by the cells of the alveoli. The alveoli is present in breast. The prolactin hormone is secreted by the pituitary gland. Option B prolactin is correct answer, secretion of milk by prolactin. Next move on to question number 43. The ratio between the chest compressions and positive pressure ventilation during the newborn resuscitation means ratio between the chest compressions and pressure breathing ventilation. Option A 1:3, option B 3:1, option C 1:1, and option D 3:3. Here option B is the correct answer, 3:1. Here 3 compressions and positive pressure ventilation will be 1. Actually 120 events per minute means approximately 90 chest compressions we have to give per minute, and 30 breaths we have to give in CPR method. Here option B is the correct answer, 3:1. Next move on to 44th question. Number 44 question. Non-invasive method of measurement of neonatal jaundice. The non-invasive method for identify the jaundice in neonates. Option A history taking, option B direct bilirubin estimation of blood, option C transcutaneous bilirubinometry, option D all of the above. Here mentioned non-invasive method, with means painless method. History taking, it is not possible to identify the jaundice. Next option B direct bilirubin estimation of blood, this is the invasive procedure, means we have to take blood from the neonate. Next option C transcutaneous bilirubinometry, same like glucometry. This is the one of the type to identify the neonatal jaundice. Option C is the correct answer. It is a validated measurement tool which is provide us the estimated serum bilirubin concentration baby is having, means in blood neonatal jaundice we can identify with the option C transcutaneous bilirubinometry. Option C is the correct answer. Next move on to 45 question number 45. Which vaccine is most sensitive to heat? Option A OPV oral polio vaccine, option B DT diphtheria and tetanus, option C DPT, and option D BCG. Option A is the correct answer, oral polio vaccine. Oral polio vaccine, it eradicates the polio and produces antibodies in the blood and prevent the poliomyelitis. Option A is the correct answer, OPV. Next move on to 46. Question number 46. The multiple tiny raised white or yellow white spots on the nose and cheeks. Option A, epistinperals. Option D, smaller patches. Option C, melia. And option D is fungal infection. Here multiple tiny raised white or yellow white spots on the nose and cheeks means we can imagine the children's. We can see the picture melia and the nose and cheeks. Option C is the correct answer. Option melia C is the correct answer. Melia is also known as a milk cyst, usually away within a few weeks after birth to months, means weeks of the birth to months automatically disappear. Melia is the correct answer, option C. Question number 47. The 47 question is elements of kangaro mother care, KMC. Option A, breastfeeding and infection control. Option B, exclusive breastfeeding. Option C, exclusive breastfeeding and skin to skin contact. And option D, skin to skin contact and infection control. Here option C, exclusive breastfeeding and skin to skin contact is the correct answer. KMC, kangaro mother care, improves bonding between the baby and mother. It will be decrease the hypothermia in the babies, means baby will be covered with covered mother, means here I will show you some picture. In this pic we can see the kangaro mother care, mother holding the baby on the chest with covering the hand. Hypothermia will be controlled with this method. Exclusive breastfeeding to be continued. Mother, not only mother, father can be gave kangaro mother care for the skin to skin contact to decreasing the hypothermia. Move on to question number 48. APGAR score includes means APGAR. In APGAR, A means appearance, P means pulse, G means grimace, A means activity, R means respiration. Appearance, pulse, grimace, activity and respiration. Here includes score will be option A, heart rate, muscle tone, reflexes, crying and temperature. Option B, pulse, respiration, crying and skin color. Option C, skin color, heart rate, reflexes and muscle tone and respiration. Option D is heart rate, skin color, respiration, temperature. Here option C is the correct answer, skin color, heart rate, reflexes and muscle tone and respiration. In APGAR score, actually we have to do baby after birth within 5 minutes. 7, 8, 9 is the normal score. Actually we have to give score 1 to 10. The newborn is good means score will be 7, 8, 9. Less than 7 means baby needs the medical attention. APGAR score. This is option C is the correct answer, skin color, heart rate and reflexes, muscle tone and respiration. Question number 49. Projectile vomiting is commonest symptom of option A, herpes disease. Option B, lower intestine obstruction. Option C, hypertrophic pyloric stenosis. Option D, jaundice. Here option C is the correct answer. Actually, projectile vomiting commonest symptom of hypertrophic pyloric stenosis. Hypertrophic pyloric stenosis will occur under the 6 months of old kids. Pylorus muscles block of food, means the blockage will be happen in the pylorus muscle from entering the small intestine. It is mainly common in male babies. Here option C is the correct answer. Next move on to question number 50. 50. Anterior fontanelle normally closure at the edge of. Option A, 12 to 18 months. Option B, 2 to 4 months. Option C, 6 to 8 months. Option D, just after the birth. Actually, in just after the birth, the posterior fontanella will be closed. Means after the birth, the closure of the posterior fontanella will be done. Here 12 to 18 months he is the correct answer. Option A is the correct answer. Actually 9 to 18 months it will be closed, but here option is 12 to 18 months is there. Before it was closed means abnormal brain development. Baby is having abnormal brain development before the 9 months and 18 months. Here mentioned 12 to 18 months. Option A is the correct answer. Before the 12 to 18 months it will be closed means abnormal brain development of baby. Okay friends, option A is the correct answer. 12 to 18 months. Anterior frontonelle will be closed in 12 to 18 months of age. Move on to question number 51. 51 question number. Tetralogy of Fallot, a type of congenital heart disease, is consist of. Here mentioned tetralogy of Fallot. Which are the conditions will come? Here option A, ASD and VSD, atrial septal defect and ventricular septal defect. Option B, ventricular septal defect, pulmonary stenosis, mitral stenosis. Option C, ventricular septal defect, pulmonary stenosis, overriding of aorta, right ventricular hypertrophy. Option D, VSD, pulmonary stenosis and tricapsid incontinence. Tetralogy of Fallot. Tetralogy of Fallot is a rare condition caused by a combination of 4 heart defects present at the birth. Here question mentioned congenital heart disease means it will be genes, through the genes will be happen. The main cause of tetralogy of Fallot is decreased blood flow to the heart. Here option C is the correct answer. VSD, pulmonary stenosis, overriding of aorta and right ventricular hypertrophy. These are 4 conditions in tetralogy of Fallot. Question number 52. Temper tantrum is a disorder commonly observed in. Option A, young adult. Option B, toddler. Option C, elderly person. Option D, adolescents. What is temper tantrum? Emotional outburst means in toddlers, it will be present in toddlers in the age of from the 18 months to very common up to 3 years. Very common in toddler age, emotional outburst. They will be shout, they will be speak loudly. In this temper tantrum, the toddler will be loudly speaking and shouting, emotional outburst. These all will be there in temper tantrum. This is the commonly observed in toddler, group of toddler. B is the correct answer. Question number 53. Relation of head circumference and chest circumference of full term baby. Means relation between chest and head circumference of full term baby. Option A, chest circumference minus head circumference less than 2 centimeters. Option B, head circumference minus chest circumference equal to more than 2 centimeters. Option C, head circumference equal to chest circumference and 2 will be same. And D, none of the above. Actually in normal means term babies, normal range will be head circumference 35 centimeter, chest circumference is 41 inches. Means low birth will be 30 to 33 centimeters will be there. Here option B is the correct answer. Head circumference is minus chest circumference is more than centimeter. Ante comparing to head circumference, the chest circumference is 2 centimeters will be more, not less than. It is be more. Here we can see the measurements of chest circumference and head circumference in picture. Head circumference first one picture, second picture will be chest circumference. Here means the relation of head circumference, chest circumference in full term babies is 35 centimeters is normal in normal babies and chest circumference is 41 inches. B is the correct answer. On to question number 54. The normal duration of puerperium. The normal duration of puerperium. Option A 45 weeks. Option B 30 days. Option C 15 days. Option D is 6 weeks. Actually, what is the puerperium? Puerperium is the post-operative means postnatal. It will come postnatal period. The time of from the delivery of the placenta through the first few weeks after the delivery. It will be considered to the duration. 6 weeks is the duration of puerperium. Normal duration will be considered to be 6 weeks. The duration 6 weeks. Option D is the correct answer. On to question number 55. The type of vaginal discharge on 10th to 15th day of postnatal period. Option A, lochia rubra. Option B, lochia alba. Option C, lochia serosa. And option D, none of the above. Actually, what is the lochia rubra? Means it will be first step of postnatal period. The lochia alba is the third step of the postnatal period. The lochia serosa is the second stage. Means lochia alba is the correct answer. 10 to 15th day will be postnatal period will come. Lochia alba, B is the correct answer. Lochia alba is the last stage of lochia. It is a whitish or yellowish white discharge from the vagina. This is the postnatal period will be occur. Option B is the correct answer. Next, 56th question. What is the gestational age of full-term baby? Means what is the gestational age of full-term baby? Option A, 38 to 42 weeks. Option B, 39 weeks. Option C, 36 to 37 weeks. Option D will be 36 weeks. Here option A is the correct answer. Gestational age means the before 36 weeks is the preterm. After 38 weeks will be term. 38 to 42 weeks will be full term. Okay. Before 37 weeks means preterm. After 37 means is a term. 38 to 48 means full term. Option A is the correct answer. Next, 57. Question number 57. The normal shape of anatomical outlet of pelvic cavity is option A, spherical. Option B, oval. Option C, diamond. Option D, rectangle. Don't confuse, friends. Here mentioned outlet of pelvic cavity. Normal shape of anatomical outlet of pelvic cavity. Actually, we are having four types of pelvis: gynecoid pelvis, android pelvis, anthropoid pelvis, and platypelloid pelvis. Here mentioned outlet of pelvic cavity. Which shape? Actually, answer is the diamond shape. Option C is the correct answer. Pelvic outlet is an approximately in shape of the diamond. Option C is the correct answer. Move on to question number 58. Weeks of gestational period of quickening. Actually, here mentioned gestational period of quickening. When the mother will feel the quickening movement. Options A, 10 to 12 weeks. Option B, 16 to 20 weeks. Option C, 22 to 24 weeks. Actually, sorry here friends, I mentioned 20 to 22 weeks. Option C is the 20 to 26 weeks. Option D, 30 to 32 weeks. Option B is the correct answer, 16 to 20 weeks. Actually, the first fetal movement of the baby, the mother feel first fetal movement. When she feel the movement, it is called as quickening. When a pregnant person start to feel their body movements of the baby body movements in the uterus, in the womb, it is feels like a flutters, bubble sounds, or tinny pulses. This is called as quickening. Option B is the correct answer, 16 to 20 weeks. Move on to 59th question. Pre-eclampsia is characterized by option A, hypertension and edema. Option B, hypertension with proteinuria. Option C, hypertension with convulsions. Option D, only hypertension. Actually, preeclampsia will be, we can see in pregnant women. Preeclampsia is a dangerous pregnancy complication characterized by the high blood pressure. Means the pregnant woman will be having high blood pressure. It will be begins from the not from the starting. It will be begins from the after 20 weeks of pregnancy period. Answer is hypertension with proteinuria. In this condition, that person will be have, means pregnant woman will be have, preeclampsia patient will be having hypertension along with proteinuria, high proteinuria in the blood. This is the one of the dangerous and serious condition in pregnant women. This option B is the correct answer, hypertension with proteinuria. Move on to question number 60. The normal range of FRH. Here, what is the normal range of FRH? Fetal heart rate. Option A 70 to 90 beats per minute. Option B 120 to 160 beats per minute. Option C 170 to 200 beats per minute. Option D 90 to 100 beats per minute. Actually FHR is a normal range will be 120 to 60. The 70 option A 70 to 90 beats per minute is the less FHR. Option C 70 to 170 to 200 is the high blood pressure, means high heart rate, high heart rate in the fetal. Option B is the correct answer. 120 to 160 beats per minute is the correct answer. In case abnormal FHR means that baby is not getting enough oxygen or other problems will be happened inside of the womb. This is the option B is the correct answer, 122 and 160. Okay friends, next we will continue next video, part 3. Okay friends, thank you for watching video. Please subscribe my channel. Click on the bell icon for further notification. Don't miss it friends. Please one click and one like friends. Thank you for watching the video.